Imagine sitting in a doctor's office, not in 5 years but today on September 21st, 2025. The room is familiar. The paper on the exam table still crinkles. Your doctor isn't just looking at your latest test results. They are looking at a screen displaying your future. A sophisticated algorithm, a form of artificial intelligence, has analyzed your entire medical history. It has processed your genetic code. It has processed your lifestyle habits. It has processed the subtle inflections in your voice during your last visit. And now, it has delivered a prediction. It says you have a 92% chance of developing heart disease in the next 7 years. The diagnosis isn't here yet, but its shadow is. This is not science fiction, this is the new frontier of medicine. We are standing at the edge of a revolution, one where machines can see the invisible seeds of disease long before they sprout. For generations, medicine has been a reactive practice. We wait for symptoms to appear, we wait for a cough, we wait for a pain, we wait for a lump. Only then do we act. But what if we could flip that script entirely? What if we could move from reaction to prediction? This is the promise of predictive AI. It offers a glimpse into our medical futures, a chance to see what's coming down the road. It's a powerful, almost godlike ability that is rapidly becoming a reality in clinics around the world. The technology itself is breathtakingly complex, yet its purpose is simple: to find the quietest whispers of illness. Think of it as the most vigilant doctor in the world, one who never sleeps. It can review millions of data points in a single second. This digital oracle sifts through mountains of information, searching for patterns that are simply too subtle for the human mind to detect. It connects a slight elevation in a blood marker from 3 years ago. It connects to a seemingly unrelated note in your family history. It weaves a story about your health that extends far into the future. The implications are staggering, forcing us to ask profound questions about life, health, and what it means to know what lies ahead. This predictive power is no longer a distant dream confined to research labs. It is here. AI systems are already being deployed that can predict the onset of over 1,000 different conditions, from Alzheimer's disease, various cancers, diabetes, heart failure. They can do this with an accuracy that often surpasses human experts. And they can do it years, sometimes even a decade before the first physical symptom ever manifests. This technology is poised to change everything we thought we knew about medicine. It hands us a new kind of power, but with it comes a new kind of responsibility and a very personal, very difficult choice. So how does this digital fortune-telling actually work? It is not magic, but mathematics on a massive scale. The AI begins by consuming vast quantities of data. We're talking about your entire health blueprint. This includes every blood test you've ever had, every x-ray, every doctor's note scribbled in your file. It also includes your genetic information, the very code that makes you who you are, often sourced from simple saliva or blood samples. But it doesn't stop there. The AI also factors in your lifestyle choices, your diet, your exercise habits, whether you smoke even where you live. Once the AI has all this information, its real work begins. It uses a process called machine learning. Think of it like this: researchers feed the AI the medical records of millions of people whose health outcomes are already known. For example, they might give it the data of 1 million people, half of whom eventually develop type 2 diabetes. The AI then meticulously scours this data, teaching itself to recognize the nearly invisible patterns and combinations of factors that preceded the diagnosis. It learns to spot the unique signature of a disease long before it becomes a full-blown illness, a signature that a human doctor might easily miss amid the noise. This process is what makes AI so powerful. A human doctor can draw on years of experience but can only juggle so many variables at once. An AI can simultaneously analyze thousands of variables for millions of patients. It can find correlations that are not intuitive. For instance, it might discover that a specific combination of 3 seemingly minor blood proteins, when combined with a particular genetic marker and a person's zip code, indicates a very high risk for developing kidney disease in the next 5 years. This offers a new, hyper-personalized view of our health. The result is a probability score, a percentage chance you'll develop a condition within a time frame. It is not a definite sentence, but a statistical forecast. It's more like a weather report for your body. The forecast might call for a high chance of rain, giving you the opportunity to bring an umbrella. The AI is warning you of a potential health storm on the horizon. This gives you and your doctor the invaluable gift of time to prepare, change, and perhaps prevent the storm. The forecast is based on data, and the more data it has, the more accurate the forecast becomes. The real-world impact of this technology is already proving to be profound. Take the case of a 54-year-old man, let's call him David, who felt perfectly healthy. During a routine checkup, his doctor ran his data through a new AI diagnostic tool. David's cholesterol was slightly elevated, but not enough to cause immediate alarm by traditional standards. His blood pressure was fine, he exercised moderately. By all conventional measures, he was a low-risk patient. Yet the AI flagged him with a high probability of a major cardiac event within the next year. It had detected a constellation of subtle markers in his blood work from the past 5 years that, when combined, pointed to aggressive, unstable plaque in his coronary arteries. His doctor was initially skeptical but ordered an advanced coronary scan just in case. The results were shocking. The scan revealed a critical 90% blockage in a major artery, a classic widowmaker lesion. It was a ticking time bomb that would have almost certainly led to a massive, likely fatal heart attack within months. David underwent a procedure to have a stent placed, opening the blocked artery. He was put on new medication and given a strict diet and exercise plan. The AI didn't just predict his future, it gave him a chance to rewrite it. His story is becoming more common as these tools are integrated into clinical practice, turning potential tragedies into tales of prevention. Another powerful example lies in the field of oncology. Researchers at one institution developed an AI model designed to predict lung cancer from CT scans. Human radiologists are highly skilled at spotting cancerous nodules, but they can sometimes miss the earliest, most ambiguous signs. The AI was trained on thousands of scans, learning to identify textures and patterns in the lung tissue that are invisible to the human eye. In a retrospective study, the AI was able to identify lung cancer in a group of patients an average of 2 years before it was officially diagnosed by doctors. It was finding the cancer when it was smaller, more contained, and far more treatable. These are not isolated incidents. Similar stories are emerging for a wide range of diseases. An AI at a European hospital learned to predict acute kidney injury, a sudden and dangerous loss of kidney function up to 48 hours before it occurs, simply by analyzing patient records. This gives doctors a critical 2-day window to intervene by adjusting medications or increasing fluids, often preventing irreversible kidney damage or even death. Each of these cases underscores the same fundamental point: these algorithms are seeing things we cannot. They are finding the faint signals hidden in the noise, providing a level of foresight that is transforming medicine from an art of healing into a science of prediction. The single greatest benefit of this predictive technology is the gift of early warning. Knowing you have a high risk of developing a disease years down the line is not a curse. It is a call to action. It transforms the patient from a passive recipient of fate into an active participant in their own health journey. If an AI tells you your lifestyle and genes put you on a fast track to type 2 diabetes, you are empowered with the knowledge to change that trajectory. Work with your doctor to implement targeted changes to your diet, start a new exercise regimen, monitor your blood sugar more closely. The disease is no longer an ambush waiting in the shadows. This head start can be the difference between life and death, or between a manageable condition and a debilitating one. For many cancers, early detection dramatically improves survival rates. Finding a breast cancer at stage 1 often means a much simpler treatment. Finding a colon cancer at stage 1 often means a far better prognosis. Compared with finding it at stage 3 or 4, predictive AI acts as an early warning system, flagging individuals who need more frequent or more sensitive screening. For all its incredible promise, this new technology casts some long and troubling shadows. The power to predict the future is a heavy burden, and it brings ethical dilemmas, psychological dilemmas we are only just beginning to grapple with. Perhaps the most immediate concern is the emotional toll of knowing. If an algorithm tells you at age 35 that you have a high probability of developing an incurable neurological disease, like ALS, like Huntington's, in 20 years, what do you do with that information? Does this knowledge empower you to live your life to the fullest? Or does it sentence you to 2 decades of anxiety and dread, a patient in waiting? This raises profound questions about the nature of a diagnosis. Is a prediction the same as the disease itself? Some people may fall into a state of vulnerable health, identifying as sick long before any symptoms appear.